So I'm here with Jean, and Jean, you're here for your 6-month follow-up.
Right.
And so we just got done doing x-rays. So this is the before picture here. Now this was at 3 months.
Yes.
So this is at 01, 18, 18. And today we did another picture of your knee. And so today is May the 4th of 2018. Now before, on the x-rays, this is the outside portion of the knee and this is the inside. So on the inside portion of Jean's knee, you can see how those bones are almost touching there. Now, today, this is the inside of the knee, and look how that gap has improved. So you're talking about a 2 to 3 millimeter gap where that cartilage has actually regrown in that knee. So Jean, from a functional standpoint, we just had you perform a squat.
Yes.
And before your stem cell injections, could you just squat down like you did?
I hadn't tried.
Okay, so you
I
wouldn't
haven't
even
tried
attempt
that
it.
in years.
Okay. And then from a functional standpoint, so Jean, we were just talking with Cheryl, your wife. How has this changed your life from a functional standpoint?
Instead of sitting in a chair all day, I do things like put gutter guard on my gutters and climb the ladder and up and down the basement steps. I've become functional where I wasn't before.
Great.
And a year ago when we went to Florida, the first thing I bought when I got down there was a chair that would help me to stand up. And this past year when we went to Florida, the first thing I bought was a bicycle. And the first trip we took on it was 3 miles one way.
Wow.
And made it okay, no problems.
So basically you went from a lift chair last year to
Yes.
riding a bike.
Yes,
So that's a good functional improvement.
definitely.
And how has it just changed your life overall? Cheryl mentioned that you're like a little kid again. So your vitality and your vibrance.
Yes, I'm looking for things to do instead of just sitting and reading and watching TV and listening to the great grandkids. I function with them now where I didn't before.
Excellent.
I actually get out on the floor with them occasionally, which I didn't do that before.
Awesome. So as you can see here, the stem cells had a remarkable difference in actually growing back the cartilage.
Yes.
And so from a functional standpoint, as well as from a physiological standpoint and a subjective standpoint, how you feel. So that's
Feel
great,
great.
Jane. That's wonderful.
Before, if I went up and down steps, I had pain in my knees and I couldn't go down using both feet stepping down. And now I go up and down steps and it doesn't bother me at all.
That's great. And what's your scale of pain on a scale of 1 to 10 now in your knees?
0.
Great.
I don't
Excellent.
have any pain.
Awesome.
I've been blessed.
So Gene, I'm going to see you back for your 9-month follow-up.
Right.
Excellent. Congratulations, Gene.
Thank you.
Great.